In today's episode, we're going over a case study of a lateral ankle sprain in a trail runner. Let's go. So I have a freebie for you today. It is an evidence-based guide to lateral ankle sprains, a cheat sheet. We go over a lot of really good stuff that's going to help you out with today's lesson, like the prevalence, the history, the prognosis, predisposing factors, mechanisms of injury, anatomy, diagnosis, differential diagnosis, treatment, return to work and sport, and injury prevention for lateral ankle sprain injuries. It is packed with info, guys. 100% free. Going to put a link in the show notes. Definitely check that out. Let's get moving. This is part 3 of a 3-part series. If you missed part 1 or part 2, go to the show notes, check out part 1 and 2. Make sure you watch those before you continue with part 3. So this is a snapshot of the second program that I gave my patient. This is day 1. I gave her a 3-day program. All the days looked very similar. I just wanted to show you exactly what I ended up doing. The goal for this program is basically to start introducing plyos. Like I said, I'm going to try to get some plyos in as much as I can, as fast as I can for patients. And if they're tolerated well, then we're going to go for it, right? Obviously, if she didn't tolerate them well, I wouldn't have given them to her. But after 1 week, she was feeling pretty good. And after we tried some plyos, she felt great doing them, okay? Just keep in mind, this is the first time trying a plyo after a fresh injury. So you don't want to go intense, right? You don't want to have high volume, just a little bit, see how you do. We can always do more in the future if things go well after that first session, okay? We're also focusing on advancing strength and balance to tolerance. So from an ankle strengthening perspective, you'll notice we'll add some more weight. We'll also increase the range of motion. We're just pushing things a little bit more, okay? So again, day 1, what did we do? We did band-assisted pogo jumps, 2 sets of 25. And we supersetted that with a double-legged calf raise, adding a deficit and a little bit of weight, as well as a single leg balance with 4-way reaching. So we basically beefed up everything. The loads during the calf raise, the range of motion during the calf raise, the challenge of the single-legged balance, and we added plyometrics, okay? We also added in some more back-to-wall tib raises, adding a little bit of weight if tolerated, a split squat using a goblet. So essentially, we just gave her a more challenging single-leg exercise she wasn't doing previously. And then we finished off with some band-resisted inversion and band-resisted eversion. As we progress over time, we just beef things up more and more, okay? The other thing to keep in mind is that we start with basic, easy exercises that address the deficits the patient has. And over the course of time, we want those movements to become more and more sport-specific. Keep in mind, she's a trail runner. She has to run on an uneven surface. She has to be able to handle lots and lots and lots of low-level plyometrics on a potentially unstable surface, uphill and downhill, okay? So you'll notice a lot of the exercises try to prepare the athlete for that. Okay, so this is a snapshot of the next program, and you'll see we made the pogo jumps more robust. So we did pogo jumps with feet together, mogul pogo jumps, wide out pogo jumps, scissor pogo jumps, diagonal pogo jumps, front foot elevated pogo jumps, which is a way we can start to progress towards single-legged pogo jumps without putting your full body weight on that side. I also incorporated some lateral drills. I think these are phenomenal for lateral ankle sprain patients to introduce a little bit of side-to-side motion, a little bit of sport-specific activity, right? And we do different cut variations to the side as well as to the front. We also do a bunch of icky shuffle variations. If you guys want to see what those actually are, I'll leave a link in the show notes so you can see some of my favorite agility drills that you can use for your lateral ankle sprains. On top of this, we have a front foot elevated calf raise with a pause, single-legged balance with 3-way upper extremity reach on an unstable surface. We're making things harder. We're doing a back-to-wall tib raise with more emphasis on the eccentric lowering portion. So again, just advancing things by adding more control on the way down. A single-legged squat. So now we're doing strengthening without that kickstand. We've taken the kickstand away. Now we're just balancing while we're performing our strengthening. And then we're also working on resisted inversion, eversion with a front foot elevated resisted supination on a slant board and doing the same thing for pronation on the slant board. I also like to incorporate some manual therapies for my lateral ankle sprain patients. Now, if you watch my videos, it looks like largely I'm a huge exercise guy, and that's exactly right. I love exercise, and it's a cornerstone of pretty much every physical therapy program I write. It's very, very rare that I have a patient I don't do any exercise with. And if I don't do any exercise with them, it's because they're already doing their own exercise, usually with someone else. I can focus on manual therapies. But yes, I like to use manual therapies with lateral ankle sprains. One of the reasons why is because we know it provides a short-term increase in ankle joint dorsiflexion range of motion and pain based on 12 different randomized controlled trials. I'm going to leave that link in the show notes if you guys want to check it out. What's also cool, and this study was by Cleland et al., is that when you combined exercise therapy with manual therapies, you're going to have a better outcome at the 6-month mark with your functional outcome measures as well as pain levels, right? So I'm going to focus on different manual therapies. You're going to have to follow me on YouTube because I actually videoed all of the manual therapies I use in this paper. I just haven't published it yet. So if you guys want to check out the manual therapies that are helpful for lateral ankle sprains, make sure you subscribe to the channel and I'll hopefully get that video out for you in the next few weeks. I also worked on some soft tissue mobility for this patient. She had limited eversion and inversion, right? She had limited dorsiflexion as well. So I did some instrument-assisted soft tissue mobilization, some massage to the calf, to the tibia anterior, to the peroneals, right? She was pretty stiff and painful in those. And she had a decent amount of pain relief after that. And then we just followed that up with exercises. After those plyos were well tolerated, we want to start a return to run program. And for this patient, she was doing plyos for about 2 weeks prior to starting a return to run program. Again, talk to you about the pogos that she did, the dynamic warm-up. I'll put a link in the show notes if you guys want to check out my favorite pogos and dynamic warm-ups. You can see exactly what she did. We worked on building up the volume. So we started with 1 set of all of these exercises, work our way up to 2 and then 3 sets, right? And then eventually we just throw in that return to run program. And if you really want to be specific about how you apply the stress, you can even count the amount of impacts that your patient has over a given session. And then when you prescribe a return to run program, you can guess on how many impacts you're going to get with a running session. You can try to match those as much as possible. So what does my return to run program look like? Now I stole this return to run program from Chris Johnson. He's a phenomenal physical therapist. He specializes in runners. And I learned this, I want to say 10 to 12 years ago. And since then, I've been prescribing it as my primary return to run program ever since, right? There's a lot of ways to write these, but this is how I like to do it. And it's been successful for me. So largely, I want my athletes to be running about 3 times per week. That's largely based on the amount of time the patient has to do a running program. For folks that like to run 3 to 4 days per week, I'm going to give them around 3 days per week. Ideally, we want 1 day of rest between sessions. This is so we don't do too much. The ankle starts to really hurt, okay? The session is going to be 15 minutes long, right? And we have to think about reducing some of the plyometric volume that we've been doing over the past several weeks. So if we increase plyometrics to the point that someone's ready for a return to run program, and then we give them the same amount of plyos with a brand new return to run program, it might be too much. So actually back off of the plyo program for a short period of time while I introduce return to running program because I don't want to overdo it, okay? That being said, what does the return to run program look like? So the session's around 10 to 15 minutes. The very first session on week 1, you do 30 seconds of a jog. So an easy jog. We're not doing any sprinting here. And 30 seconds of a walk. Loop that for 10 to 15 minutes. Do that 3 days a week. So Monday, Wednesday, Friday. And on week 2, we do 40 seconds of a jog, 20 seconds of a walk. Week 3, 50 seconds jog, 10-second walk. And by week 4, if things are going really well, we just try to run 10 to 15 minutes straight, right? And then from there, we just work on increasing volume, a couple minutes per session until we build our way up to whatever the patient wants to be able to do. In this case, it's 60 to 120 minutes, right? She's got a lot of work to do to build all the way back up, right? For folks that have a past training history of running a ton, I generally feel a little more comfortable making bigger jumps from session to session, right? But for folks that have like absolutely no background in running, I would just go a lot more slowly, right? Because we can probably advance a little faster in the athlete that has a huge training background of endurance or distance running. For someone who just doesn't have that background at all, we probably just need to go a little bit more slowly. So guys, if you like what you're learning about so far, then I want you to go and check out the Fitness Pain-Free Mini Course. So I made a mini course. It's absolutely free. That's the next logical step if you want to learn more from me. So in the course, we go over 5 lessons. That first lesson is how traditional schooling has failed us, right? So schooling is phenomenal from a physical therapy perspective, but doesn't really teach you how to work with high-level athletes in the fitness world, right? Doesn't always teach you how to do the lifts appropriately. Doesn't teach you about progressions and regressions of common lifts within the gym. Doesn't teach you how to program normally, how to write rehab programs, or how to write injury prevention programs for these folks. Next thing we go over, 7 reasons why people get hurt in the gym. 4 simple steps to getting your clients out of pain, how to build the career of your dreams and earn the respect of your community. It's all well and good if you know exactly how to work with folks within the gym. But if you can't get these folks through the door on a regular basis, then you're simply not going to be living the dream that you want to, because you can't get the patients through the door that you want to work with. Okay. So I'll show you how to do that. And lastly, we'll talk a little bit about the fitness pain-free certification, right? So I'll leave a link in the show notes. I definitely recommend checking this out. Once you sign up for the Fitness Pain-Free Mini Course, you will be automatically placed in the waitlist for the Fitness Pain-Free certification. Now, the Fitness Pain-Free certification is the course, the certification that I wish I had as a new grad, that fills in all the gaps in knowledge that you don't get in physical therapy school. So A, you'll gain complete confidence working with injuries in the strength and fitness world. You'll learn optimal technique for both health and performance from myself and some of the best coaches in the world. You'll master programming for rehabilitation and injury prevention. Have fun while earning a whole bunch of physical therapy and physical therapy assistant credits. You have 31.5 of those. You'll also gain NSCA credits as well as CrossFit credits if you need those. This is the equivalent of a university education in working with injuries in the weight room. I really believe that. I've been adding to this thing over the past 5 or 6 years. It's massive, a ton of phenomenal information. And lastly, the biggest goal is just to fill your day with the patients you love working with and building the respect and admiration of the communities you love working with. So I'll leave a link in the show notes. Sign up for the Fitness Pain-Free Mini Course. The certification is open 4 times per year for 1 week to enroll into. If you're on the wait list by signing up for the Fitness Pain-Free Mini Course, I'll alert you when that next enrollment period is open and you can get started. Let's get back to the show now. From a running perspective, we start with flat ground running, right? And if you think about it, running up hills or running in trails is just a little bit more challenging on the ankle than running on flat ground. So we basically start with flat ground running. As someone's doing well with that, I start to introduce some hills. And lastly, I start to introduce some trails. Now, it actually might be worthwhile to do some sort of return to sport testing prior to going back to trail running, just because you want to make sure that ankle is really capable of handling all the forces you may encounter on the trail, right? But that's just a thought, right? I think that it's just a good reasoning, to try it, and not something that's like black and white that you definitely have to do, okay? Another principle I like is volume over intensity. So we're making sure we're building up the volume that the athlete wants to be able to tolerate before we introduce kind of speed runs. So a lot of runners don't just go out and run a long distance, right? They do that, obviously, but they also do sessions where they're doing, let's say, track work or intervals, right? Or fartleks or something that requires higher speed running. I like to build up volume first. And once an athlete has shown they can tolerate the amount of volume they want to, then we start to slowly incorporate intensity over the course of time. That's hills, track work, interval work, just like I said, right? And then from a periodization standpoint, I'm not going to go crazy in depth on this. I've talked about this a bit more in prior episodes about return to run. I'll leave a link in the show notes if you want to check that out. I'm largely trying to return my athletes back to some sort of polarized or pyramidal run program. So if I start writing their program, let's say 3, 4, 5 months out, and I'm past that stage where I'm just kind of rehabbing and I'm starting to think about performance, I'm utilizing one of these periodization programs in order to get them back to their running. How about return to rock climbing, right? So my patient loves rock climbing. And, if you think about rock climbing, you're like, well, why would I have to avoid rock climbing? It's my ankle. My ankle is, hurt, not my shoulder, right? I can still rock climb. And I'd largely agree with you. It's just that if you fall and land on that ankle and you have a fresh ankle sprain, you run the risk of hurting it more, right? So I think that generally speaking, if you're climbing with a rope, someone that's good, you have a good friend that's good at belaying, right? That's not going to forget about you up on the wall so you fall and have to catch yourself, right? If they're going to be good at belaying you, I'd say you can kind of start your climbing as soon as comfortable, right? With a rope. Just keep in mind when you come off the wall and you're coming down relatively quickly, you still have to handle the forces of landing, all right? So I would say you want to make sure they can tolerate some sort of impact before you return back to rock climbing. My patient just waited. She's like, I don't really care that much. I can wait longer. I don't feel like I have to rope climb right away. Let's get my strength back in my legs. Let's focus a little bit on running. And then eventually I can get back to rock climbing when I feel good, right? The advice I gave her for bouldering, which is essentially climbing without a rope, and I'm not a climbing expert, but from my understanding, you climb without a rope. Usually you do this and it's a bit more risky because you can fall. And oftentimes you're falling towards kind of rocky terrains below you. And I actually recommended she waited for longer to do some of the bouldering. I actually wanted her to perform well in some of the return to sport testing prior to getting back. I just didn't feel safe for her falling off the wall at a weird angle from a high height and being able to land well, right? So the other advice you can give your patients, and this is certainly what I told my patient in the moment, was start with low challenge bouldering, and then over the course of time, obviously, you work to a higher challenge, right? Just because it's very high challenge, you might fall off the wall and you don't expect, maybe you're higher up off the ground, and that fall is going to be a little bit harder to control well with that ankle. All right, so what is going on from an advancement and an eventual discharge perspective? Okay, so our rehab started at a low level, working towards improving all the deficits the patient had, building up strength, building up balance, all the things that are important after you have a lateral ankle sprain injury. And lastly, we want to progress towards the athlete's sport. So then sport specificity becomes more and more important. So we largely have to get our athlete ready to trail run, which is going to be a variety of surfaces, uphill, downhill, sandy surfaces. She's probably going to be landing on some roots, probably going to have to make very quick adjustments. She's going to be doing a low-level plyometric activity, right? So she's jogging for 60 to 120 minutes, 1 to 2 hours, right? Has to be able to handle thousands and thousands and thousands of repetitions of plyometrics at a low level, right? So that's what we're preparing the ankle for, right? Then lastly, as we get towards the end stages of rehab, I'm actually focusing on just getting her to be a better runner, right? We know things like adding a dynamic warm-up, a little bit of plantar flexion strength, applying a pyramidal or polarized program. All those things are going to improve your performance as a runner. So we're thinking about performance towards the end stage of rehab as much as we're thinking about rehab itself, okay? The other thing that's on my mind and was on our mind towards the end stage of rehab is some sort of return to sport testing, right? Now, full disclosure, I saw this patient, I want to say 4 to 5 total visits. And her last visit, she basically had an emergency. She wasn't able to come to physical therapy. I wanted to do some return to sport testing. I wasn't able to, right? This happens a lot as a physical therapist. We always have this pie in the sky idea of my patient comes in, I do a super thorough evaluation. We progress them all along the way. At the very end of the rehab, we do a great return to sport test. They get back, right? That's often not the case, especially for, I'd say, very busy professionals, right? People have families. For athletes, maybe we're able to go through all these stages really well. For busy professionals, oftentimes they can't come in, they have to cancel, they don't get the amount of visits you think is appropriate, they can't do the return to sport, right? They're just busy, okay? So I actually wasn't able to do return to sport testing with her, although I wish I had. I didn't actually do that, right? So was she kind of ready to get back? I don't know, but I think she was pretty dang close, right? So in terms of return to sport, we don't have a lot of good research to guide our return to sport for lateral ankle sprains. So we do have one study that utilized something called the PASS, P-A-A-S-S framework. It was basically a consensus of experts that came together to try to figure out what you should test on your athletes before getting them back to sport. And the PAASS framework stands for pain severity. It's how much pain you have during sports participation and over the last 24 hours. So basically, I would like to have her do some trail running. And how did it feel? Did you have any pain? How'd you feel 24 hours later? Okay, how is that going? Next one is going to be ankle impairments. So how's her range of motion? How's her strength? How's her endurance? How's her power? So I would measure her range of motion, make sure she's close to symmetrical, measure her strength, right? And then you can measure endurance and power through a variety of, let's say, jumping tests, okay? Next is athlete perception. Does the athlete feel like they're ready to return to sport? So you can use a psychological readiness test to see if they feel like they're ready. So was she ready to get back to trail running? She actually felt like she was. I texted her, see how she's doing. She's like, I feel pretty good and getting back to things. And I said, great. If you want to come in, we can take a look, advance you, let me know. Otherwise, sounds like you're doing good, right? And that was kind of it for her. Also, testing sensor and motor control is important. And this could be from some sort of STAR excursion balance or Y balance test, testing their dynamic postural control, making sure you have good symmetry between sides. I have a good video about the STAR excursion balance test. I'll try to leave that link in the show notes so you can check it out. We also want to make sure we have good sports or functional performance testing. And this is going to vary a lot based on the individual, but largely for my athlete, I wanted to make sure that she was able to handle some running. Can we go into the woods and run 20, 30, 40 minutes and then feel pretty good while doing it? Okay. That would be kind of my testing for her. All right. Like I said, I wasn't able to do a thorough return to sport session, but I think she actually did okay. And sometimes that happens with your patient. I purposely chose this patient to do a case study on because I knew it wasn't perfect, right? I feel like I constantly pick case studies where the rehab goes perfect. And that's actually very rarely the case. So this one wasn't. So how many visits did I see for this patient? We only did a total of 4 to 5 visits. This is over a course of about 6 weeks. Now, I'm a cash-based physical therapist. You can get insurance reimbursement, but we're out-of-network providers. That just means that basically the patient has to try to get reimbursement themselves. Generally speaking, per visit, we tend to be a little bit more expensive. Really depends on copays and the like, but I just tend to see patients a little less frequently than most standard physical therapy practices. So largely, I was seeing her once per week initially. I think you could make the argument that twice a week might be decent just because you're able to do your manual therapies twice per week, which may lead to a better long-term outcome, right? I just did one time a week and I thought that was fine. After a few visits, we basically went to every other week, right? And like I said, she basically self-discharged. She kind of missed what was going to be probably her last session. And then I ended up texting her to see how she was doing. She felt like she was doing really well. And I said, hey, if you want to come back in, let me know. We can do some more testing. I think it'd probably be wise to do that before you get started. And she said, I can reach back to you if I feel like I need it. Otherwise, I'm feeling good and I'll talk to you later, which I'm fine with. That's okay. I just want to let people know that it'd be beneficial to test, right? If they decide that that's not what they want to do, that's fine, right? That's life. So now that I've gone through a case study and you see exactly how I like to treat lateral ankle sprains, you need to see the exact exercises I like to use to get these folks out of pain and back to their activities. I have a really good video for you. I'm going to leave a link in the corner. It's my favorite single leg balance exercises for folks after lateral ankle sprain injuries. Definitely go check it out. And lastly, I just want to say thank you so much for your support. If you're watching this on YouTube, please hit that thumbs up button. I'd love to hear your comments on how I like to rehab. Did I miss something major? Let me know. Disagree with me? Let me know, right? I love to hear it. And it also helps me out tremendously if you subscribe, right? Because you can see more videos like this, keep up to date with all the good stuff I'm putting out there. If you're watching the podcast version of this, please give me a 5-star review. A positive rating helps me out tremendously, allows me to continue making content like this in the future, 100% free for you. And if you want to go the extra step to really support the channel, consider subscribing to Fitness Pain-Free Insiders. It's a comprehensive educational resource and toolkit for the fitness and rehab professional. Think Netflix, but for trainers and physical therapists. It's premium content from yours truly, very similar to the podcast here. I've been updating this monthly for the past 5 years or so. I'm currently working on adding lots of courses, right? So not only are you getting more lessons, webinars, guides, you're getting complete courses in here. I've also recently added CEUs. So if you're a physical therapist or physical therapy assistant, you can get CEUs. And the best thing is it's only $1 to get started. After that, it's $25 per month, but you can cancel at any time, right? Get CEUs, $1, cheapest CEUs you can possibly get. All right. So if you want to learn more, I'm going to leave a link in the show notes. But otherwise, when you get started right away, go to fitnesspainfree.com, click on the programs link, click on Fitness Pain-Free Insiders online library to get started. If you want to see the references, there are a million of them, and I know you can't see them very well now, but I've left all the references in the show notes section. Check those out if you want to see the studies I included. Thank you guys, and goodbye.